Waking up with dry mouth? This could be a warning sign of serious health problems, doctors explain. What if I told you that waking up with a dry mouth every morning might be one of the earliest and most overlooked warning signals your body gives you about your heart, your blood sugar, your sleep, and even your brain health, and most people completely ignore it for years because it feels too small to matter. Before we go any further, do two simple things for me right now. First, if you care about staying sharp, independent, and healthy after 60, subscribe to this channel because what we share here is designed to help you catch serious health issues early, before they become life-changing problems. And second, write a comment below and tell me how long you've been experiencing dry mouth in the morning. Weeks, months, or even years, because sometimes patterns only become clear when we start talking about them. Now listen carefully because what I'm about to explain is something I see far too often in clinical practice. People don't suffer from one big problem. They suffer from several small signals they ignore until they suddenly connect into something much bigger. Dry mouth is not a disease. It is a signal. And in many cases, it is one of the earliest signals your body uses to communicate changes happening quietly in the background. Let's start with something most people underestimate: mouth breathing during sleep. When you breathe through your mouth all night, airflow constantly passes over your tongue and throat, evaporating moisture faster than your body can replace it. You wake up with that dry, sticky feeling, sometimes a sore throat, sometimes cracked lips, and you assume it's harmless. But here's the truth most people miss: mouth breathing is rarely the root cause. It is usually a clue pointing to something else. Often it's nasal congestion, chronic allergies, structural airway issues, or something far more important: sleep apnea. And I need you to understand this clearly. Sleep apnea is not just snoring. It is a serious sleep disorder linked to increased risk of high blood pressure, heart disease, stroke, and cognitive decline over time. If you wake up tired even after a full night's sleep, or someone has told you that you stop breathing at night, this is not something to wait on. In my clinical experience, I've seen patients whose simple dry mouth led us to uncover severe sleep apnea, and once treated, not only did their dry mouth improve, but their energy, focus, and blood pressure improved as well. Now let me reset your attention for a moment, because this next mistake is extremely common and almost always misunderstood. Many people try to fix dry mouth by drinking a large glass of water right before bed. It sounds logical, but physiologically it doesn't work the way people think. Your body does not instantly hydrate tissues on demand. Fluid balance takes time, and what matters far more than nighttime drinking is hydration consistency throughout the day, especially in the afternoon. As we age, our thirst signal naturally becomes weaker, meaning you can be mildly dehydrated without feeling thirsty at all. On top of that, many older adults intentionally reduce fluid intake in the evening to avoid waking up at night to urinate. The result is predictable. By morning, your body is already starting the day slightly dehydrated. I once treated a retired woman who insisted she drank plenty of water, but almost all of it was consumed after dinner. We simply shifted hydration earlier, morning, lunch, and mid-afternoon, and within a week, her morning dry mouth improved significantly. Sometimes the solution is not more water. It is better timing and distribution. Now here is where I want you to pay close attention because what I'm about to say next is something most people never connect to dry mouth at all. Yet in medicine we see it more often than you think: nutrient deficiencies. Your salivary glands are living, active tissue, and they depend heavily on nutrients like vitamin B12 and vitamin A. When vitamin B12 levels drop, which is extremely common in adults over 60 due to reduced absorption in the gut, you don't just get dry mouth. You may also experience fatigue, brain fog, memory changes, and even subtle changes in taste or appetite. I once saw a patient who came in worried about early dementia because she felt mentally slower and not herself. Her B12 levels were severely low. After treatment, she told me something I will never forget. "It feels like my brain came back online." That is how powerful something simple can be when identified early. Vitamin A is also essential because it maintains healthy mucosal surfaces in the mouth, throat, and nasal passages. When it is low, those tissues become less efficient at producing moisture, making dryness more noticeable and persistent. Now let's go deeper because this next combination is one I take very seriously in clinical practice. If you are waking up with dry mouth and you are also urinating multiple times during the night, this is not something to ignore or dismiss as aging. That combination can sometimes be an early sign of blood sugar imbalance or type 2 diabetes. When blood sugar rises too high, the kidneys work harder to remove excess glucose from the bloodstream. In doing so, they pull fluid from the body, leading to internal dehydration. One of the earliest places you feel that dehydration is your mouth, especially overnight when you are not drinking anything. I once had a patient in his late 60s who came in for joint pain and casually mentioned dry mouth at the end of the visit. When I asked about nighttime urination, he said, 2 or 3 times every night. That single detail led to a blood test, and we discovered undiagnosed diabetes. He later told me, "My body was warning me for over a year. I just didn't know how to listen." And that is something I hear repeatedly in medicine. Now let's reset your attention again, because this next condition is one of the most commonly misdiagnoses in older adults. It is called Sjogren's syndrome. This is an autoimmune condition where the immune system mistakenly attacks the glands that produce moisture, especially salivary and tear glands. The result is persistent dry mouth, dry eyes, difficulty swallowing, and often fatigue or joint pain. The reason it is missed so often is because symptoms appear in different places and are treated separately. Dry eyes are treated by one doctor, joint pain by another, and dry mouth is dismissed as normal aging. I had a patient who described it perfectly. "It feels like my body forgot how to stay hydrated." After proper testing, we confirmed Sjogren's syndrome, and finally everything made sense. So if you have both dry mouth and dry eyes, especially if you are a woman over 60, this is something worth discussing with your doctor directly. Now let's go even deeper, because this next part surprises almost everyone. Your salivary glands are controlled by the autonomic nervous system, the system that runs your body automatically, including heart rate, digestion, and saliva production. When this system becomes disrupted, saliva production can decrease. In some cases, early changes in this system have been associated with neurological conditions such as Parkinson's disease or related disorders, sometimes years before motor symptoms appear. This does not mean dry mouth equals neurological disease. It absolutely does not. But when it appears alongside other subtle signs, like loss of smell, constipation, or changes in sleep behavior, it becomes something worth evaluating rather than ignoring. I once had a patient where dry mouth was the earliest clue, but what truly changed everything was when his wife mentioned he could no longer smell his morning coffee. That small detail led to early neurological evaluation and early intervention. And now we arrive at the most common cause of all, the one hiding in plain sight: medications. Over 500 commonly used medications can cause dry mouth, including antihistamines, antidepressants, blood pressure medications, bladder medications, sleep aids, and muscle relaxants. The real issue is often not a single medication but the combination effect, what we call anticholinergic burden, which can also affect memory, focus, and cognitive clarity over time. I've seen patients feel significantly better simply by reviewing and adjusting their medication list under medical supervision. One man told me, "I didn't realize how foggy I was until I started feeling clear again." That is why I always say, never assume your medication list is harmless just because each drug was prescribed for a reason. So here is the most important takeaway I want you to remember from everything you've heard today. Dry mouth is not something to fear, but it is also not something to ignore. It is a signal, not a diagnosis. Sometimes it reflects simple issues like breathing habits, hydration timing, or environment. Other times, it reflects deeper patterns involving sleep disorders, metabolic changes, autoimmune conditions, neurological shifts, nutrient deficiencies, or medication effects. The difference is not the symptom, it is the pattern behind it. And here is your action step starting today. Don't guess. Observe. For the next 7 days, pay attention to your sleep quality, hydration timing, nighttime urination, medications, and morning symptoms. Write them down if needed. Then bring that information to a healthcare professional and have a structured conversation based on patterns, not assumptions. If you've stayed with me this far, I want to thank you, because it shows you are taking your health seriously, and that alone puts you ahead of most people who ignore these signals entirely. If this helped you understand your body better, Subscribe now because this channel exists for people who want to stay independent, sharp, and in control of their health for as long as possible. And before you go, answer this in the comments. What is one subtle change in your body you've noticed recently but never fully understood? Because sometimes the most important health breakthroughs don't start with a diagnosis. They start with finally paying attention.